Great. Good evening, everybody. Today is August 7th. We are here in council chambers for the Health and Human Services Council Committee meeting. The public's more than welcome to join in person for our committee meetings. However, we do not accept public comment at our meeting. You're always more than welcome to email us at council@everettwa.gov if you'd like to share comments, or you can always call in or join a general public meeting for comments. Tonight, we just have one agenda item. It's the Drug Crisis Task Force findings briefing, which is way more of a mouthful than I was expecting. And we have a number of folks here this evening to share more about the originations of the task force, the task force process, and some of the findings that are presented in a report this evening. I'm very glad to have Mayor Franklin joining us for our council committee meeting. So I'd like to kick it off over to Mayor Franklin to share more about the task force and tee it up for us. Thank you.
Thanks, Councilmember Ryan. Yeah, I'm excited to be here to go over the recommendations from the Mayor's Drug Crisis Task Force. This is obviously a super important area of work for our city. The fentanyl crisis is not unique to Everett, but it is unique and compared to anything we've ever faced, and cities across the country are dealing with this, and so this was a very important body of work. First, I want to thank Councilmember Ryan. You were the council liaison, and you attended, I think, all the meetings and observed, and I know how passionate you are about this as well, so really appreciate your support of the work and kind of seeing it in action, so that helps enrich and deepen your understanding of the recommendations. As an observer, it was, a lot of this was based off of, kind of back in the day, the Community Streets Initiative, where I participated, but as an observer, it was really great to see kind of the work underway and the different recommendations that were coming out of the task force and how much they deepened their understanding of what we're dealing with. When we put together the task force, it was really important to have a wide array of experience and expertise. I think that we did an excellent job of that. The co-chairs, Donna Moulton and Jonathan Schwartz, were from the public sector and the nonprofit sector, which provided a lot of balance. But then we filled the room with folks from the nonprofit sector, from law enforcement, from business and community leaders, neighborhoods, and of course, people with lived experience, which I think was really, really important. Again, because this is so different than anything else that our community has faced. I'm really grateful for everyone who participated. Councilmember Ryan knows this from observing the meetings, but it took a lot of courage to really listen and learn. People got very emotional when you're talking about the trauma of those that are suffering from addiction, but also the trauma of those that are dealing with those with addiction. I think one of the most interesting meetings was where the task force members heard from our first responders and just the pain and that they experience in trying to help again and again and again people who are suffering at such a great level. So really just wanted to kind of highlight how hard the task force was, and appreciate the recommendations that they are bringing forward. One thing I want to add before Chelsea goes over these recommendations is a lot of these recommendations, we focused the work again on the city of Everett. I think a lot of things in the Community Streets Initiative kind of stretched out beyond Everett. We tried to focus on Everett-centric recommendations, but a lot of this requires funding. And even at the final meeting of the task force, all the task force members reiterated the importance of nothing is going to happen without money to do this work. So it's going to be challenging because we are not a revenue rich city. And so I think we'll be heavily reliant on grant funding to implement any of this, as well as perhaps some funding from the opioid settlement. So I think we'll have to be very strategic with the recommendations and prioritize. But they're all very important and very valuable in tackling this crisis. So I want to hand it over to Chelsea. I'm grateful to have Chelsea's leadership. She led us and participated in the task force. She has a wealth of experience and expertise in helping people and addressing homelessness and addiction. And we look forward to working with her in implementing these recommendations and other work in the Community Development Department. So I'll hand it over to you, Chelsea.
Thank you. Chelsea, before you start, if you could share your full name and title just for the record, that'd be great. Thank you.
So thank you, Mayor Franklin, and I'm Chelsea Monroe, Project Coordinator with the Community Development Division. So as Mayor Franklin was saying, these recommendations are going to be really Everett's focus, and it was the mayor of Everett's Drug Crisis Task Force. And so we officially kicked off this meeting on February 1st earlier this year, and we met 9 times through the end of June. And each meeting was about 2 and 2.5 hours long. And so task force members really gave a lot of themselves to participate. I know that many of them are probably happy to have their Thursday afternoons back. I kind of miss meeting and seeing all of them, but am excited to be presenting this work to you folks, because that does hopefully mean that we can then move forward with what this looks like in the future. So the meeting structure, for those of you who weren't able to attend and observe, was really set up to be both a mix of subject matter experts coming in to do new education, new learnings, again, really having that Everett lens in focus. We relied on some of our partners at the county and other agencies here in Everett to come in and educate the task force. And then the second part of their meetings were really diving into the work and truly understanding just how complex. I think that no one came to this thinking it was easy, that there would be an easy solution, but with every new idea and everything that we talked about, it just started to peel back those layers and really truly understanding, even for those of us who have done direct service, it's complicated, and it is going to take all of us coming to the table to have these conversations if we want to see change. So what we are going to be going over tonight is the executive summary, which is the front and back page that you have. In your folders, you do have the full report, which will have more of the needs and rationale, and certainly spend time diving into that. But tonight we're going to be going over the executive summary, which is really just those nitty-gritty details of if someone's wondering what it is that the task force recommended and what it is, like your speaking points, this is what that tool is. And so for me, it's really helpful in being able to make sure that, again, that we're focusing on what the task force wanted, which is 15 recommendations to be presented to Mayor and all of you. So during our journey together, the task force members divided into subcommittees. There were 4 subcommittees, and that's really where they spent their time focusing on deeper learnings, and then ultimately each of those subcommittees came up with the recommendations. So the 4 subcommittees were treatment, recovery and services, crisis response, education and prevention, and advocacy and policy. And so I'm going to walk through each of those and then call out just a couple that I think are worth mentioning, and maybe a little more explanation. So without further ado, if it's okay, I can just kind of launch in. So starting with treatment, recovery, and services, I don't think it's a surprise to folks to hear that the needs or the resources in our county are insufficient to meet the need. Again, things are more complicated. A lot of the first responders talking about how the level of needs has increased for the folks that they're responding to. And so the needs and the services that we have in our community, while robust and great, they aren't meeting the needs that they're experiencing now. And so this is something many communities are struggling with, but again, just really reiterated through that treatment, recovery, and services. And as Mayor Franklin mentioned, having the voices of those with lived experience really helped to inform and shape the recommendations and really grounded us in the work. I think that there were some folks that had disclosed their lived experience and their journey with substance use disorder prior to joining the task force, and then there were some that actually took, used meeting 2, 3, and 4 as an opportunity to say, hey, I didn't plan to share this, but I feel compelled to share it because everyone else is being courageous and vulnerable, and I want to make sure that my voice is heard too. And so that was a really moving time, I think, for each of the subcommittees to develop those relationships and that trust within each other. And then, another theme that we saw a lot is just making sure that as we're exploring new sheltering options and housing options, making sure mental health services are part of that conversation. This was a drug crisis task force and really focusing on the drug crisis, but we can't also then ignore the mental health needs, oftentimes co-occurring and parallel issues. And so making sure that we're removing barriers for folks to access those services will only be able to strengthen the recommendations in addressing the drug crisis. So the recommendations Number one, develop and execute a crisis and care coordination strategy in the city of Everett. This will really lean into the work that we're already doing to expand the social work team. And I know that those voices were also represented in this subcommittee, and so really looking forward to that. The recommendation number 2 of successfully launch the EMOTE, Emergency Mobile Opioid Treatment in Everett program. I'm really thankful to have Senator Robinson's support in making sure that that was in the budget and ongoing support for this program, and excited to announce we have officially launched that program last month. I know they're starting to meet folks where they're at. Just had a quick check-in with them, and they're already exceeding their goals that they thought they would in the first several weeks, and so I know they're feeling really good and working out some of the kinks as to be expected, but feeling really optimistic. I think having this recommendation also then validated the work that the city is already doing, and subcommittee, they certainly were aware of this work, but really validated it through this recommendation that this is something they'd like to see moving forward. When we talk about new sheltering options, including for recommendation 3, again, that addiction and mental health services, this will be really important when we think about partnering with the county and community partners. Making sure that someone has somewhere to call home or lay their head at night goes a long way in what their journey to recovery looks like. And so it's one accomplishment to get somebody to the point of accepting care and getting them into services. It's a whole nother thing when we're able to say, hey, once you go through this program, we have somewhere for you to stabilize while we continue to support you. And so, we can't have one without the other, but that's where some of the disconnect in services seems to be right now. And then the 4th recommendation, strengthening communication and coordination between service providers and community members to increase knowledge of relevant resources. This is one, again, where there's a lot of great work happening in our community, but there's also been a lot of change over the last 5 years. And so how are we maximizing the resources and efficiencies while strengthening the coordination and communication between folks? And then recommendation 5 is to ensure adequate and accessible detox beds and opioid treatment programs. And I will say that continuous support post access to services is something that was reiterated over and over again, and I think you'll see in the rationale and needs as well in the full report. I'm going to keep going on this. Okay. So next we had crisis response. This was a subcommittee I personally got to spend a lot of time with and really enjoyed having both law enforcement and lived experience voices at the table for that conversation. I think that we were able to have really rich conversation within each other and being able to see where maybe there's different perspectives, but ultimately we all want the same thing. And so that was just really a humbling experience to be able to be a part of that. So again, just really understanding that the need for emergency and crisis response has skyrocketed, and that's something we heard over and over from the first responders and crisis responders on the task force. And the city does have limited control over some of those laws governing how we respond to substance use disorder. And so recognizing that there is going to be changes at the state and federal level that are needed to support this, but trying to focus on what we can do here in the city of Everett. And so as Mayor Franklin mentioned, one of the most meaningful meetings that were reported by members, we did an activity with the Fishbowl. It was called the Fishbowl, and folks from the city sat around a table quite like this, and then the task force members observed them have a conversation. And there was a lot of emotion behind it. There were some tears and heartache, and the impressions that they left on the task force members were so meaningful and so impactful, and it is still a meeting that's talked about to this day, because I think that there is a perception of what showing up as a first responder looks like, and then there's the reality of how much this weighs on them when they leave the uniform, when they check out for the day, when they go home. And so they were able to show up as humans, and I think that it just highlighted what a strong force we have within the city, and that we want to continue to support them. And so
let's also add that their social worker team and our legal team were at that fishbowl as well. So it's not
Yes.
just the first responders, but the bigger team that responds to crisis.
Everybody that's trying to address and help this.
yeah, thank you. So as crisis response subcommittee, recommendations were to identify, assess, and reimagine community spaces and buildings to increase capacity for crisis response needs. The next one was to increase funding, capacity, and training to support public and emergency services. Again, going back to that secondhand trauma, things like that also play into being able to retain folks, making sure that they feel supported to show up and do their jobs, but also being able to give them tools to be able to train all city departments on how to, when we're interacting with community folks and partners, how do we all make sure to have the same message on what does a referral look like, who to contact, that sort of stuff. The next one is to establish a centralized communication platform to share among crisis and first responders to better triage and support those in crisis. And this really had a rationale focused on how do we support first responders in being proactive and engaging with folks that typically are high users of the crisis response services. And so not waiting until, police have heard from somebody 100 times, but starting to track the trends and making sure we're communicating within each other. Again, going back to how do we maximize resources. And then the last one, expand the City of Everett's first responders tools for intervening to calls of violent or threatening behavior, particularly in those cases involving those with substance use disorder. And this really speaks to, I think, a lot of the calls that the mayor gets, along with, I'm sure, some of you around someone calls 911 because there's someone that they think is violent or threatening in the streets, and police respond, and they may not meet that legal definition. And so the community's looking to us to do something, but us as the city can be hands are tied in what that response can look like. And so being able to expand the tools that they have in that moment, so it's not just I don't have anywhere or anything for you to give you. So that's where that one came from. And then the third group was education and prevention. And this group was really focused, I think you'll see, with the youth and young folks. This had a sense of more hopefulness around being able to get ahead of this crisis. We have to rely on education and prevention if we are going to help solve this crisis. But they also really push us and challenge us as a group to make sure that we have resources and materials that are available in multiple languages that are culturally appropriate for engagement. Some of our task force members even started taking the translated materials and sharing them out in their communities as we were going, because they recognize that there's such a need for that. And so I know I'm in the process of getting the report translated into Spanish, and that was something that came at the request of the task force as well. But just making sure, as a city, we have a diverse population. We welcome diversity and we're stronger because of it, but making sure that then everybody in our community has equal access to materials and trainings and opportunities, especially around that education and prevention piece, is really important.
Can I jump in just a second on
Yeah.
education prevention as it relates to youth? I'll speak from experience. I have a 15-year-old daughter, and she has received zero education on fentanyl or opioids in school. She's received lots of education on alcohol and marijuana, but there is no education currently being delivered. And this is, it's terrifying. And so, as a parent, I'm constantly saying, take nothing. You can't take an Advil from someone. You can't take anything, even if it looks like it, because it could be fentanyl. All kinds of things could be laced with fentanyl. But because this crisis has happened upon us so quickly, and fentanyl has really overtaken all drugs and synthetic opioids, the education has not caught up with it. But this is very important for us to get ahead of to stop the crisis. So.
Yeah, I was on a overdose awareness call and conversation earlier today, and they were talking about a local fire was talking about how one of the things that they're currently dealing with is that students in local high schools are thinking that they can Narcan themselves, and so they're actually trying to get in there right now into local schools and talk to students because there's been several reported cases of that, and they just have a lack of understanding because there isn't that education, and how teens and young people absorb information and digest it is different, right? And so having the tools to meet them where they're at in a way that's going to hopefully allow them to digest the information is really important. And go ahead.
Well, I just also will add that last legislative session did add a requirement to our schools to add opioid education. So if we can walk alongside and be supportive of that, then hopefully we can make faster movement to help our schools and our kids to get that education they need.
What age group were they? Did they start at a certain grade level?
I think high school.
High school.
Yeah,
but
maybe
it-
middle school,
it
yeah.
should be younger for sure.
Is it high school? Yeah.
So the education and prevention group you'll see has 2 recommendations, and they knew pretty early on in the process that these were the areas that they wanted to focus on. They didn't waste any time. They knew it. So their first one is to expand and diversify partnerships with youth-serving organizations to prevent drug use through education and culturally appropriate engagement with the youth and their families. Again, that youth focus just being such a big part of the conversations they were having. And then launch culturally responsive outreach and awareness campaigns in multiple languages to increase the public's understanding of risks associated with using fentanyl and how to get help. And then last but not least, we had the advocacy and policy group, which I think you'll see in the full report that there is a level of advocacy and policy that's needed throughout all of the subcommittees and their recommendations, but making sure that this was called out because it is going to require advocating for funding, for changes on state and federal laws, things that cross all of the subcommittees. So the goal and some common themes with the advocacy and policy group was to make sure that we're set up to have a 2025 City of Everett advocacy agenda. This will help again with helping hopefully to secure funding, changing existing laws, and to affect the long-term change that's necessary to make a difference. The first recommendation that they came up with, which also crosses on several other recommendations, is to advocate to amend Ricky's Law, the Involuntary Act, to make it less, to create more involuntary options. So right now, it is, Ricky's Law allows for involuntary options. However, the threshold that somebody has to meet or be deemed is such a high bar that it's often not able to be used as a tool for first responders. And so being able to make it so that it is a little easier to deem someone an imminent threat to themselves or others would allow them to then have more involuntary options.
And I'll just jump on this one. I was just on a call with Snohomish County, and we were talking about this very thing, that county has it on their legislative agenda, I think, coming up as well, or they will. And it really is there's this incredible gap where, somebody is clearly not able to take care of themselves. They've been revived with Narcan 5 times in a single month. So this is really behavior that is incredibly harmful. It can cause them imminent death if they weren't revived with Narcan. When is that threshold where we can actually say there needs to be a step in involuntary commitment? And so I think there's a lot of, this is a recommendation for Everett, but I believe it's countywide. A lot of mayors have been talking about this very same thing. And again, just today I was on a call with Executive Summers and mayors across the county, and everyone has this deemed as a priority area.
The Association of Washington Cities has it on their agenda as well.
Exactly.
Yeah, it's an important one. Next was to advocate for long-term sustainable federal and state funding to support task force recommendations. Again, as Mayor Franklin said in the beginning, this work is going to need funding to support most of it. And so recognizing that will be an ongoing need. Next, they had advocate for permanent funding sources for multi-jurisdictional drug task forces. And so this one is really important when we think about how we're going to stop the supply of drugs from coming into the city of Everett. But also, this is the body of work that will help with public safety. And so making sure that this one is supported loud and clear is really key to making sure that the rest of the recommendations are also successful. And then last but not least, we have advocate for programs that offer healing opportunities to community members impacted by the drug crisis. So that was a lot of information, I think, in a short amount of time, hopefully. So I just wanted to thank folks again for taking the time to listen. Thank you, Councilmember Ryan, for being the liaison and showing up and giving, again, so much of your time to be there those Thursday afternoons with us. I am very hopeful that the city of Everett has a lot of committed partners, staff, folks that are willing to come to the table, continue to have the hard conversations, roll up their sleeves, dig in and do the work. I have to have hope because otherwise sometimes it can feel a little daunting when we think about this, but I also don't think that there's a city better poised to be able to do this work in a way that's meaningful and intentional in a dignified way, but also recognizes that it's complicated. And so really thankful to have your leadership as well. So thank you.
Fantastic, thank you. Go
And
ahead.
I'll just add a couple remarks, and then, I'm sure you guys might want to talk some more, but I recently did a Coffee with Cassie video. It's available online, and it features the two co-chairs, so Jonathan and Donna. And I encourage you, if you haven't watched it, to watch it, and hopefully the community will watch it too, because we have a really good in-depth conversation about the work of the task force, and so they share a lot of their perspectives and learnings and thoughts. I think that the community also can access the entire task force. It's on our website, so that if you go to the mayor's link, right, it's on the mayor's webpage, you go there and you can get the full report and read that, so that's important for the community to know. We'll be working, obviously, in close partnership, although this is focused on Everett. We are not an isolated bubble, so we're focusing on Everett, but we're doing it in partnership with our nonprofit, our faith-based partners, and our county, and hopefully our other jurisdictions. So it's going to be a collaborative effort, even though we're focused on our own city and how we address the challenges there. Our co-chairs that did that we contracted with to do the work did a really great job. I think it was new for some of the folks to kind of have touchy-feely experiences, especially the first responders, perhaps. But they really did a great job in pulling it together. So I really want to publicly thank Gracie and Laura, Gracie Jeremiah, thank you, and Laura Chisholm were the consultants, and they did an outstanding job. And again, I want to thank Julie and your entire team, as well as Chelsea, because they connected quite often with our task force members. There was a lot of work that happened outside of just the task force meetings, an incredible body of work, and then Chelsea's work is just beginning, so appreciate it.
Thank you. Julie, did you have anything you wanted to add?
No, I'll just wait for questions.
Okay, great. Yeah, I really enjoyed the experience as well, as much as, learning more about a devastating opioid crisis can be enjoying. But it was definitely clear just how passionate and committed our city employees are to working to help protect those that are suffering, and also helping to protect the city as well. And there's a lot of resources that have been going into the opioid crisis to respond to it and the effects of it and the residual effects of it. And I don't think there's a single department at the city that hasn't been impacted. So some of the most important, or some of the most impactful meetings for me were the ones hearing from the departments that you might not think of first that are responding to the opioid epidemic. So our libraries, we had a park ranger share about trying to help folks at parks, and our public works team, and there's just a lot of ways that the opioid crisis touches our city. So I know that resources are incredibly scarce, and that there's an extra strain on resources as the result of the crisis. So really appreciate the city's work to do what they can with what little means that we do have. One of the because I'm an overachiever and I can't not do extra work, I have been working on a memo to share about my experience with the crisis, the drug crisis task force, and some of the connections that I saw between different meetings, and some suggestions that could possibly be added to the report. So whenever I manage to finish that off, I'd be happy to send it along. But one of the things that I did hear quite a bit that I'm not seeing reflected was the how critical peer-to-peer support was for people who had been struggling with addiction, and how just that interpersonal relationship with a person had to let them know that they're worth recovering was really a pinnacle point for them to move towards stability. So I think it's kind of like a subcategory of maybe some of the recommendations, but just want to give a push for that as well. And then I also wanted to mention too, just like for the record, one of the things I was really impressed by with the education and prevention part was during the presentation, the person that presented was sharing more about how when approaching culturally sensitive information for different groups in the city, to take a look at the numbers of people who are disproportionately represented in addiction numbers for a certain demographic category. So it might not be the most number of people in a group, but it is a disproportionate number within a category. So just when we're thinking about translation services and whatnot, that might be a good equitable way to approach it. I have a couple questions, but I'd be happy to pause for a second if there's any other questions or clarifying things.
Just have a couple questions. Well, thank you so much. It just sounds like it was really an amazing experience for everybody and tremendous amount of work here. I'm just curious what our next steps are. I mean, this is really great work. I hate to see it sitting on a shelf. And so if there's any plans for how we're gonna, next steps on this?
Well, some of it's already underway, such as the emote program, right? And so that work is not on a shelf, it's actually underway right now. And that is one of the reasons why we have Chelsea kind of looking at all of these, working closely with Julie and prioritizing this workload based on where we have the resources to implement it. And so I think we will be in constant communication. We'll probably give updates on either through Council Digest or my comments or, you know, a couple report outs at council meetings on work that's underway. But we definitely have work underway. The stuff under advocacy and policy will come into our legislative agenda. So that you should see developing this fall so that we can be working towards that in the winter. But yeah, you will see action. That's what.
Yeah, and I'll also add, additionally, I've been able to send out some emails to the task force, so it wasn't like we just ended and then they haven't heard from us. So as there's opportunities here locally to do trainings, or I know there's some things that the county's helping to do at the end of this month. Opportunities like that have been presented to them, and they'll be getting some more email communications. They, of course, have the option to opt out from not hearing anymore if they want, but most folks are really committed and have continued to express a willingness to partner with the city. They want to be involved. They want to hear from us regularly. They also will make sure that this doesn't sit on a shelf because they're pretty action-oriented group of folks. So I'm excited about that.
I'd also throw out that when we did the Streets Initiative, there were 63 recommendations, and then when that ended, then we had to break out into subgroups and to try and prioritize them. This task force broke into subgroups first and helped really prioritize into 15 recommendations, and so we really feel like the body of work that they provided to us is reasonable and something that we're going to be able to tackle in a manageable way, and certainly having some staff focus to do it, because that also is extremely important.
Great. So I was thinking about the opioid settlement money and wanted to check in on how the money coming in from the opioid settlement plan, and if this county's public safety sales tax goes through in November, how a spending plan would be developed and how that spending plan might help with funding some of these recommendations.
I think that this is our first kind of formal community body of work that's going to help us to create a spending plan moving forward. So that's kind of the next step, is to kind of determine what on here can we utilize opioid settlement funds, be able to get that approved, through you, and then start moving the work forward. And, you know, just today we had a multi-city with county leading opioid settlement fund conversation. So the work is in progress with each city and the county to try and continue to move that work forward. And the nice thing is there's not a lot of pressure to like have a deadline of when we have to do it. So we want to do it right, but we also want to start it because we have this great information as a launch pad.
Great.
Yeah, so, you know, we're immediately using some opioid dollars just so that we can begin this work. So we have staff that can work on this work, so we'll be, but this will develop into priorities and say, okay, with this amount of money that we're getting over the next 2-3 years, our goal would be to do X, Y, Z. We'll bring that to you, say, this is our initial spending plan. I want to remind the public that it's not like we're getting millions of dollars from the opioid settlement all at once. It kind of trickles in from multiple different sources. And so it's, the spending plan will be a moving target. You know, we'll develop it based on the resources that we know are coming in. Then as additional resources come in, then we'll add to those priorities and expand on that work. But it'll be a constant, something that we will review over and over again throughout the course of the next few years.
Okay, great. I think that was my only question. So under the crisis, actually, I do have one more question. Under the crisis response, category number 8, I was talking about the centralized communications platform. Is this the same or different from Chart 2.0? Or did Chart 2.0 get launched? I'm trying to remember kind of how that shook out.
You know, Chart 2.0, the work to understand who are kind of our most chronic utilizers has taken place. But at the same time, when we have mental health staff deficiencies, agencies are so tapped out, they're working so hard, we weren't able to really bring back the providers on a regular basis that we were originally able to do with Chart. So we kind of ebbed and flowed a little bit and tried to base our relationships more one-on-one on the individuals that needed the help and get them connected. And as our social worker team grew, they all are kind of learning about who are these individuals and what do they need. And so it wasn't such a defined Chart 2.0, but more as a philosophy of how we're going to do our work in this climate when our agencies just couldn't give as much time sitting around a table having meetings.
Okay, great. Thank you. Go ahead.
So I don't know if we can answer this or not, but I know in the past we've talked about the lack of treatment beds and how important that is. And I know at one point there was conversation about the jail maybe moving more towards that. And I don't know if anybody has a handle on what the void is on treatment beds.
We have a huge void. And I know that the county, through their sales tax initiative, whatever, proposition that's going to come to voters in November, are looking to spend some of that on detox, secure detox beds that could lead into treatment. But treatment beds, we're very much reliant on the county and the state to fund, hopefully through their opioid settlement dollars. And so as those are built, then we can try to increase access to them and do everything we can. But at this point, our city does not have the resources to add to those beds. We're just working in collaboration with our partners, and it maybe goes down into the advocacy and policy section of ensuring that we have funding directed to those areas for that purpose.
Our state has certainly added new treatment beds, but none of them are in Snohomish County. So we still have the transportation issue, we still have the reconnecting to the community issue, and there's only so many beds, so we still have the capacity issue that there's just not enough of them.
And the county, I believe it was one of their public safety committee meetings, they did a presentation on the secure withdrawal management center and some ideas for where that could be and what it would provide. So that information and presentations out there.
Yeah, I think they took the jail off the table. It was cost prohibitive, but they're looking at other locations, and we are encouraging them to look at those locations and also countywide.
Yeah, right.
Great. Any other questions or comments? Great. Thank you again, Chelsea, Julie, the team. Thank you, Mayor Franklin, for pulling the crisis task force together. I think the recommendations are really crucial to help just get a better pulse on what would be most effective moving forward. So I see this as a really great step for the city and a really hopeful step for the city as well. So thank you for that. Any last things? Great. It's 5:40 and we are adjourned. Thank you.